Hi, I'm Phil Parazio from the University of Pennsylvania, and this is a quick video to help you understand your kidney tumor pathology report. So congratulations, you just had kidney surgery to remove a tumor that was either cancerous or suspicious for being a cancer. I'll walk you through the basics of a pathology report so you understand what you're looking at when you see them yourself, and you can think of questions to ask your surgeon or your doctor if you have any questions. So the first portion of a pathology report is typically a narrative portion, which describes what was found under the microscope in text. Typically, the first line describes the specimen. So in this case, it was a left renal mass. You may say right renal mass, or you could even see left or right kidney if you underwent a radical nephrectomy or removal of the entire kidney. Next, it says what surgery was done. Partial nephrectomy, once again, removal of just the mass and sparing the kidney, or radical nephrectomy, removal of the entire kidney. It may even say things like lymphadenectomy or tumor thrombus resection, depending on the kind of surgery you had. The next line is the narrative description of the tumor itself. This pathology report is referring to a cancer. So you'll see clear cell renal cell carcinoma. Clear cell is the most common type of kidney cancer. There are also papillary and chromophobe tumors. Those are the three most common together. There are a whole number and list of other entities that can be renal cell carcinoma, but are a little bit more rare. Renal cell carcinoma is the most common type of kidney cancer. So that is the overall overarching term used to describe kidney cancers. Now, if you don't have a kidney cancer, you could have a benign tumor, something called an oncocytoma or an angiomyolipoma, or sometimes something even called a neoplasm. If you see that in the first line, it typically refers to the fact that it wasn't a cancer, but instead was an abnormal growth or a benign growth on the kidney. The next component is typically the grade. And you see here, WHO or ISUP, grade 3. Grade 1 and 2 tumors are low grade, meaning under the microscope, these are not aggressive looking cells, not aggressive looking cancers. A high grade tumor is either grade 3 or grade 4. This means they look aggressive under the microscope and have the ability to grow outside of the kidney and potentially spread. But not all high grade tumors will grow or spread beyond the kidney. It just means that they could. In general, low grade tumors do not. The next line has to do with the size, and you'll see the largest dimension typically mentioned first, 3 by 2.5 by 1.8 centimeters. This tumor was a small renal mass, once again, about 3 centimeters in size. Size helps us understand the stage because we know for organ-confined cancers, meaning tumors confined to the kidney, the smaller they are, the lower the stage. Importantly, the bottom two lines here says tumor is limited to the kidney. That means it is not growing either into the kidney or into the structures around it. And it also says surgical margins are uninvolved by tumor. That means there was no cancer microscopically left behind. Most surgeons who do a lot of kidney surgery will never grossly or macroscopically or with their own eyes leave cancer behind. Now, if you look deeper through your pathology report, you'll see something called a synoptic. And this is a more detailed version of the same pathology report. You'll see here, it says kidney nephrectomy summary. Once again, lets you know that it was a partial nephrectomy, so just the tumor was removed on the left side. Greatest dimension was 3 centimeters. Focality says that only one tumor was removed. It tells you the histologic type. Once again, that clear cell renal cell carcinoma. This will tell you exactly what the tumor was. Sarcomatoid and rhabdoid features are really aggressive features that are only rarely present in kidney cancer, but really important to note. That's why they're highlighted on most synoptic reports. Once again, your grade is identified here as G3. Once again, grade 3 tumor. Necrosis is a sign of cancer that has outgrown its blood supply and has died, usually a sign of high-grade cancers. Fortunately, no necrosis on this specimen. And if you look at the microscopic tumor extension, tumor was limited to the kidney. It was a stage 1 tumor because of its size. A stage 3 tumor would be growing in either the fat or the blood vessels surrounding the kidney. A stage 4 tumor would be growing into structures or organs around the kidney, like the colon, the spleen, or the liver, depending on the side of the body, or into the veins, either into the renal vein or potentially even up to the vena cava or right heart. Those are all called stage 3 tumors. Lymphovascular invasion describes growth into small blood vessels and lymphatics within the kidney. Pretty rare, to be honest with you, to see that happen without growing into larger vessels as well. And in this patient who had a partial nephrectomy, a lymph node dissection was not done. However, if you had a larger tumor or there were suspicious lymph nodes, this is exactly where you can read about them. Now, the vast majority of kidney cancer surgeries, you are not going to see distant metastases. We typically don't surgically operate on patients who have metastatic kidney cancer, but if an adrenal gland was removed that was suspicious for cancer or a portion of the pancreas, you may see this in the same setting. The last part will give you your pathologic stage. And you can see for this tumor, they had a T1A tumor. This means 4 centimeters or less, completely confined to the kidney. A stage 1B tumor is larger than 4 centimeters, smaller than 7, once again confined to the kidney. A stage 2 tumor is larger than 7 centimeters and confined to the kidney, where stage 3 we talked about, once again growing either into the structures in the kidney or around the kidney. And stage 4 tumors have metastatic disease or growing into organs adjacent to the kidney. Once again, no lymph nodes in this patient because they had a partial nephrectomy and had no suspicious lymph nodes at the time of surgery, and they did not have metastatic disease. So you can see in total, not only is this a T1 tumor, T1A tumor, but this is a stage 1 kidney cancer. And importantly, the bottom line, almost every kidney surgery, if there is normal kidney tissue removed, the pathologist will take a look at it to tell you if you are at risk of developing kidney disease in the future. In this patient, the partial nephrectomy had very small margins, but the cancer was completely removed, so there was not enough tissue to assess their normal kidney function. I hope that helps. Feel free to review this video as many times as you want to get the basics of the pathology report, but either myself or your surgeon, if you're having this done elsewhere, would be happy to talk about your pathology report and help you better understand your kidney cancer.